If you've been diagnosed with trochanteritis or you have pain on the side of your hip, especially when you walk or when you lie on your side in bed, you're in luck because this video is made especially for you. We're going to look at 6 exercises where you'll discover ways to relieve tension in all the muscles. Relax your hip and mobilize it in order to reduce the symptoms, so you feel better and have a better quality of life. To do all this, you won't need much. Just a cushion to be comfortable, a mat, although you can also do them on the bed. And I'm going to use a strap. You don't need to get something like this. You can simply use a very long blanket, a very long towel, or several belts hooked together. The goal is for that elastic, that strap, that object to allow you to anchor it at the foot and hold it with your hands, that's all. And like me, I've also had pain on the side of my hip for several days. In the same way, these exercises are not only going to be good for you, but they're also very good for me. This way, we start to mobilize the flexion of our hip and relax the joint. Simply hug it with your hands, push a little toward your shoulder, and relax. We push that knee with our hands, left knee toward the left shoulder, and relax too. We're going to do 10 repetitions. Just push the left knee toward the left shoulder, not too tight, just a stretching sensation at the level of the glute and hamstring. Relax 3. Push the left knee toward the left shoulder again. Hold for a few seconds. Relax 4. Push. Relax 5. Come on, let's keep going. We move to the side just a little. Lie down, I'll guide you. We repeat, relax 6. 4 more. Push the left knee toward the left shoulder. 7. And I'm already noticing how this little movement is starting to help me. I loosen my hip a bit, I feel less pain. 7, 7, and 8, that's 8. With this one we keep pushing. 9, last repetition, I push my left knee toward my left shoulder. And 10, very good, relax. I let my leg drop, let it rest on the floor. I close my eyes for a moment, enjoy the relaxation afterward, and I'm going to bend the other leg. Be careful with this exercise because it can be a bit challenging. I want you to bring up your left leg, pull on your pants and lift it toward you, and then grab that heel and foot and move it outward. Look, the sole of the foot is facing my right side. That way my malleolus, the little bump here at the ankle, will rest on my thigh, as if I were crossing my legs. Pay close attention, I'll show you from the other side. Side camera. I've crossed my leg. I've placed my malleolus on my left thigh. From here I'm going to grab my strap. I'm going to bring my right leg a little closer to me, which will also pull my left leg along. And pay close attention, I'm going to place the elastic band right below my knee. I pass it through and we have 2 ends, one on the inside, one on the outside, one on the inside, one on the outside. I'll show you here again. What do we do with this? Stretch the external muscles of the left hip. Look, I bring that elastic band right down to the base of the knee. I grab both sides firmly with my hands and I'm going to pull with my arms. Lift the right foot off the floor and all that. What it does is bring the left leg into external rotation. Look, if I show you with the other camera, I was in this position. I lift the right leg, pulling toward that band, and therefore the left knee also comes closer to my shoulder, but in a rotated position. And this causes us to have some tightness here at the level of the glute and the hip. It might be a little painful at first, but it shouldn't cause too much discomfort. What we're going to do is simply hold for 30 seconds while breathing, and I want you to, with each exhale, blow out and bring your knees a little closer to your chest. Inhale towards your chest, exhale. 2, inhale. Exhale. 3, very good. And if you notice a lot of pain at any point when stretching, don't go so far, okay? It's normal to feel some tightness, but you shouldn't feel pain. 4, I said 30 seconds, but since we're here, let's do 10 repetitions. 5, release 4, 4, 3, 4. It's a very good exercise. 7, because then it can be modified a lot depending on the position of the leg. I'm going to show you right now how you can do it after this first set 9 last rep. 10. If you notice that the exercise is uncomfortable, even when you start to lift your legs or you raise them just a little because there's a lot of tightness or you want to work with more intensity, pay close attention. What we can do is modify the position of the leg. If the leg is more crossed, look closely. Now the ankle, the little bone, is not resting on my thigh. The exercise becomes more difficult if we move that foot further outward. Now it's the outer edge that's resting. Wait while I set up the other camera for you. Yes, as I said, the little bone stays outside, making it harder if the outer edge is resting. Here, on the thigh it's easier, just like if the leg is farther away it's easier, and if I bring it closer to my belly, if that heel is closer, it's harder. So you can really play in 4 dimensions. More inward, more outward, more bend, less bend. Give it a try because it's an extremely good exercise and it can really help you with your symptoms, and don't be scared if it causes a problem, just a little bit of discomfort. At first, very good, we take advantage of being here to hook that elastic band right here under the foot. That's it. I stretch the leg very slowly there, very good. The elastic helps me lower it carefully. I'm going to stretch the opposite leg completely so that it's well supported on the floor, and now we're going to do a stretch for the tensor fasciae latae. I want you to use your arms to lift your leg, blanket, strap, whatever you have, that belt, and I want you to pay attention. Cross your leg until you start to feel tension on the outer edge of your left hip. Okay, basically, I'm lying on my back. I pull that leg inward until I start to notice that my left buttock lifts up. Look closely, my left buttock lifts up, and that's when I start to feel tension at the hip level. You're going to need some internal strength. The buttock lifts up. I pull a little more, and now I feel a lot of tightness on the outer edge of my leg. Some of you will feel tightness sooner, others will need more rotation to feel tightness. Okay? This will depend a lot on your flexibility. Alright? Let's go over the steps again. That elastic band is hooked onto the foot. I lift my leg a little, add tension with my arms, cross the leg about 30-45 degrees of elevation. Okay, you can see it clearly here. I cross my leg over the other, my left buttock lifts off, as you can see here. And from here, I already start to feel some tension. If I come more inward, there's more tension. Okay, if I come much more, there's even more tension. Don't overdo it either. Okay, just try to find some tension along the lateral edge. It's not going to be very specific either. It's a bit of a diffuse tension, okay? But it's actually pleasant, okay? And just stay there. It's important that the knee is fully extended because if it's not, we're not working the muscles. Correct, incorrect, like this, correct, correct. And from there, well, we're going to hold for about 30 seconds while breathing. Take a breath. Goodbye. And every time I exhale, look, I try to move that leg a little bit farther. I inhale. We exhale. We exhale, exhale, exhale. Very good. 3. I'm going to move over here so you can see me. 4. 5. Very good. I'm going to take 5 breaths, which is about 30 seconds. Then I return to my starting position and rest my foot. A common mistake with this exercise is allowing the left shoulder to lift. We shouldn't lift it, only the left buttock, which starts to lift when you raise your leg and rotate. Why? Because we also want the lower back to stabilize the hip here a bit so it works properly. The stretch of the tensor, the fascia lata, and that knee always fully extended. Also, later we'll see a variation where we position ourselves completely on our side. Okay, let's do the next exercise, which is exactly that variation. Now what we do is position ourselves completely on our side. On the right side, I want you to place both legs bent, one on top of the other, with your heels right below your buttocks, just like I'm showing you here on the screen. and we use the strap in the same way. Before, we were lying more on our backs, so there was a very good rotation at the level of the back, which anchored the pelvis. Now it's completely different. Now I want you to bring that foot forward as much as you can. Place it on the floor, and once it's there at rest, use that strap again. Not to pull your foot toward you, but to lift your leg. Here I already feel a lot of tightness in the back of my leg, the side of my hip, always trying to keep that knee from bending. As you can see, the tension is completely gone. I keep my knee completely straight, add a bit of tension to my foot, lift my leg, and bam! I already feel a lot of tightness there. Basically, here what we have to do is, again, 30 seconds, 10 breaths, whatever you want, whatever feels comfortable for you. I'm going to fold this here to be more comfortable. I'm going to set up another camera for you, and we're going to do 6 or 7 breaths. We take a breath in, notice how I relax the strap, exhale, pull on the strap, and lift the leg a little. Very good. The difference now is that the leg is supported, that we are completely on our side, and that the stretch is being worked from another point of view. I take a breath in. I relax, exhale, and pull my leg up a little more. I relax. I can even bend my knee a little. Only when I relax and let go, I stretch everything and pull my knee up a bit more. No more than that, because it might break. 4/2014. Very good. 5. Very good. I shot well, and 6:30 seconds, 6 repetitions, 10. As many as you want. We slowly return that leg to its starting position. Very good. If you feel any hip discomfort, try small taps. Honestly, just doing these exercises is already helping. Now we have the last one left. I saved it for the end because it's the most complicated of all, and I'm not sure everyone will be able to do it. But it's also very good for mobilizing the hip and working on stretching all the muscles, and it's really good to do it. I invite you to put on a pair of long pants that you can grab with your hands, because we're going to need to place your foot vertically. We get into the same position we were in before, lying down on our side, one leg over the other. I want you to pull on your pants and grab the bottom part. This is going to allow us to pull until your foot is completely resting on the floor. I'll say leg again. Starting position, we pull up, we pull, we try to hook onto the bottom part of the pants, we pull that bottom part and try to get that foot to rest on the floor. Not everyone can do it because not everyone has good hip mobility. You could also do it with the strap we already had here. Basically, we make it go over the ankle, that's it, and from here we simply pull on that foot to bring it closer. And a bit more orthodox, less comfortable, I prefer the pants option. Well, both are fine. Once we have that foot anchored, the left hand is going to be placed on the knee, and the right hand is going to take care of anchoring that foot to the floor. If you're feeling that bad, it's better not to do it. If you're only halfway here, if your foot is practically well supported, if you're really comfortable with your foot on the ground, perfect. I'm going to show you from another point of view how it looks. Now you have to pay attention to your left knee, your right shoulder. As you can see, there's a small distance between them. What we want is to reduce that distance. My left hand on the knee, as I already told you, pushes the knee a little toward the shoulder. What can happen in this case? Well, the knee might sink and give way, but that's not the case because that's what our right hand is for. Anchoring the foot on the floor. I bring the knee toward the right shoulder, hold for a few seconds, relax, and then push it. I bring the knee toward the right shoulder, hold for a few seconds, relax, and push. Come on, let's do 10 together. I push toward the right shoulder, relax, and push down. 3. This is the most complicated one of all. If you see that it causes too much discomfort, you can leave it on the bench and try it a little later. 4. Come on, let's keep going. It's an exercise that also puts demand on the knee. 5. Let's go again. Come on. 6. Let's go again. 7. Come on, 3 more. Let's go again. 8. Again. 9, last repetition again. And 10. Perfect. Slowly we're going to slide that leg back to where it was and place it on top of the other one. We relax with gentle taps at the hip level if there's any discomfort, if this position isn't relaxed. For you, also placing a small cushion there between your knees, both here when you're resting and at night, can be very, very good for relaxing your hip. And you might say, Marcos Sacristan, it's only 5 exercises, you promised us 6. Very good. Now we're going to do the 5 with the opposite leg so you can see exactly how they are so you get a quick review. And finally, I'll show you the 6th one, which can be used on both sides. Okay, let's continue. So I get my strap, my elastic band, whatever you're using, my towel. I get my microphone back and lie on my back. What was the first one? Do you remember? Tell me, which one is it? I hope you got it right. Let's bring that right knee toward the right shoulder. Remember, we've worked on the left side. First of all, it's very simple. Basically, we grab that pant leg, pull it toward us, grab the knee from the front, and apply pressure so that my knee is as close as possible. At the shoulder level, we can do some breathing, we can do repetitions. Let's just count to 10, that's all. I relax, I don't push anything, and when I release, look, I bring my right knee toward my right shoulder, I take a breath, and as I exhale, I want to bring that knee toward my right shoulder. 2. Applying a little more pressure with each repetition. And notice that if you now pay attention and feel your left hip, you'll see how there's a certain relaxation, right? A certain relief after the exercises we've done. I notice it because I've had hip pain for a few days now and it doesn't go away. 3, 4, I don't know. How many have you done? Let's go. 5 more. I'm pushing. 6, 4, 4. I'm pushing knee to chest, to shoulder, not to chest. Okay, it's a habit I have of saying 7. Come on, 3 more. I'm pushing knee to shoulder. 8, 8. I'm pushing knee. 13. 9, last one. 10. Very good. I slowly rest my leg down on the floor, bend opposite leg. What's next? Cross one leg over the other. I take my right leg and cross it over the left. The ankle bone should be roughly at the level of the thigh. We already know that we can make it more challenging in several ways by moving that leg further outward, bringing that heel closer to our abdomen. You can see it well there, right? No? I've changed the camera, and from here what I'm going to do is use my elastic band to thread it between my legs from the outside and inside. Notice how it's like a little thread. I place it right next to the corner. The crease here at the knee, right in that spot, the higher up, the better. And from there, I use my arms to bring both legs with me. Where am I going to feel it? Simple tightness in the right buttock, okay? Some of you feel it a lot, others feel it a little. It depends on your hip mobility. I have quite a bit of mobility, so I feel just a little stretch, and from here I play around. It's a rocking exercise. I do 10 repetitions, and each time I exhale, I pull a little more with my hands. 1, come on, let's count to 1, 0 together. I grab down, exhale, and pull up 2. I exhale and pull with my arms. Also, this helps you work the muscles in your arms. 4. We release. 5. 5. 9, 22, 23, 27. 4, 7, 8. 18, 19, 20, 32, 37. 40, 41, 45, 47, 48, 54. 53, 55, 59, 60. 60. 72, 72, 73, 74, 75, 80. 83, 84, 85. 86. I breathe and stretch both legs next. 87, 88, 89, 90, 91, 92, 92, 93, 94, 95, 96, 97, 98. In this way, so that it stays approximately at the level of the finger pads, 100. 92, 93, 94, 95, 96, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28. Here you have to reach a point where you start to notice for some people it's a bit of tightness, others will need much more. I especially recommend not going all the way to the floor because we'll work on that in the next variation. I stay here, more or less crossed, knee well stretched, and from here, with the right shoulder well supported on the floor, we're going to hold the position for 30 seconds or do 10 repetitions. You already know I like both. I take a breath in, and as I exhale, I want to go a little further. 1, and we exhale. 2. With each exhalation, I try to cross my leg a little more, but we're not going to go all the way to the floor. 3. It should never cause pain, just a bit of discomfort. That's fine. It doesn't have to be intense. Okay? 4. Let's do 2 more. 5. Which camera do I have? Let's switch to this one for the last one. Let's release. And 6, from here, if you want, you can let yourself fall all the way down to the floor. Okay, let's bend both knees and put them together. Heels right here, just under my buttocks. Not in front, not behind, just underneath. Bend your knees about 90 degrees. From here, I get into position. I'm going to fold this pillow to be more comfortable. I take my elastic band. Pay close attention. What I'm going to do now is stretch the leg that has the elastic band, and from here, once we're at this point, all that's left is to lift it up. Okay, this is going to happen because when you start to lift it, there will be a lot of tightness in the back of your leg, and it can also appear on the outer edge. Most importantly, your knee is going to do this. It's going to bend, so try not to let that happen. Keep your knee fully extended. Add a bit more tension with the elastic band. Don't overdo it, because if you pull too much on your foot, there will also be a lot of neural tension, and we won't get what we're looking for. Just keep the elastic there and lift your leg as high as you can. Very good. We're going to do 6 breaths. We'll also count those 6 repetitions together. Each time we exhale, we try to bring that leg a little higher, okay? We inhale, and as we exhale, I pull a little and try to lift that leg a little higher. Very good one. I release the elastic a little. I can even bend my knee when I inhale, and as I exhale, everything stretches and I add tension. And up 2. I relax everything, let go, lift that leg up a little. Very good. 3. I lift that leg, stretch it completely. 4. Release, extend the tip of the foot. 5. Release. And 6, very good. I'm going to slowly return to the starting position. I'm going to take this opportunity to completely remove the elastic. You saw it disappeared like magic. We'll set it aside. Let's breathe honestly. These exercises are really good. My left hip, which was hurting, is much better. I can put weight on it and it barely bothers me now. Let's continue with the last one, the most challenging of all. Pay close attention. I grab those pants, pull them up, all the way to the bottom. The pant leg, as we say in Spain, and from here, I place that foot on the ground so it stays steady. If your foot is like this, I don't like it. Try to avoid the exercise because it won't do you any good. You can place your foot halfway, like this. Perfect. You can support it well. Keep it vertical. Very good. From here, your left hand is going to anchor that foot to the ground, and your right hand is going to move the knee. Pay close attention. I want that knee to get closer to the left shoulder, so the distance between the two gets shorter. Look how well that camera is positioned, because when I bring it closer, look how it moves. Bam! What a good feeling here in my right glute. Some people feel it more, others less. For example, on my right side, I don't feel it as much. On my left side, I feel it more. I inhale, relax, bring that knee a little lower, exhale, pull, and bring my knee toward my left shoulder. 1, I inhale from here. I exhale and pull my knee to my left shoulder. 2, I exhale and pull my knee to my left shoulder. 3, I exhale and pull my knee. Good sensations. 4 here at the glute level. We release. 5, and we release. 6, very good. Slowly I pick up my leg, place it again over the other leg, and close my eyes. And I enjoy the relaxation in my hips. Incredible. I'm sure you're waiting for the 6th exercise, and it's a small exercise we do for the lower back because there's a strong connection between lower back mobility, hip mobility, and the appearance of trochanteritis. It's a very simple exercise. Pay close attention. We're going to leave that camera. I want you to bring both knees, just like we did at the beginning, toward each of your shoulders. Left knee toward the left shoulder, right knee toward the right shoulder, close so that there's some pressure with your hands. I want you to look, extend your index fingers upward. Imagine they're pencils. What we're going to do with both pencils is make circles, big circles, keeping a good distance between your knees. 2, we're going to do 10 to the left, 3, and 10 to the right. 4, an excellent way to finish relaxing. 5, those hips and also the lower back area. 6, your index fingers draw a big circle. 7, on the ceiling. 8, 9, and 10, then the opposite side, 1, 2, 2, 3, 4, 5, 6, 7, 8, come on, last 2, 9, big wide circle, and 10, very good. Support your feet on the ground, make small rocking movements with your legs to finish relaxing. Very good. Honestly, these exercises have been extremely helpful for me.